You've been told your whole life that masturbation is shameful, something you should have outgrown by 50. But here's the truth no one shares after 60. It's not just normal, it could be the line between vitality and decline. I'm Dr. John Smith, a urologist with over 30 years helping men over 60 reclaim their energy, confidence, and quality of life. I've seen the silent damage of neglect, shame, and misinformation. Too many men suffer not from illness, but from what they never knew. Most older guys masturbate the wrong way, or worse, stop altogether. They don't realize how they touch themselves, how often, and with what intention shapes their hormones, heart, even their brain. One simple act done poorly can fuel erectile dysfunction, depression, or prostate issues. Done right, it can boost testosterone, improve sleep, and keep your circulation strong. This isn't just about pleasure. It's about protecting your body's function, reconnecting with yourself, and fighting aging where it starts in your nervous system. In this video, I'll share 7 secrets about masturbation every senior should have learned decades ago. Ask yourself, if one daily habit could unlock better health, mood, and vitality, wouldn't you want to know what it is? Stay with me. This could change how you live the next decade. If you haven't subscribed, hit that subscribe button and turn on the bell to catch science-based health tips for folks in your stage of life. If this resonates, type 1 in the comments. If you're skeptical, type 0. Your feedback helps me create content that serves you. Let's dive into the first secret, because how you've been masturbating for years might be quietly working against you. The first secret is one I wish more men felt brave enough to talk about. Mindless masturbation can lead to numbness and erectile dysfunction. I remember Michael, a 67-year-old retired banker, coming into my clinic with his eyes down, voice barely above a whisper. After some talk, he opened up, "Doc, I don't feel much anymore. I can still masturbate, but only if I do it a specific way. Otherwise, it's like my body forgot how to feel." That confession hit me hard. I've heard it from hundreds of patients. They didn't know their rushed mechanical approach was training their body into dysfunction. It's not just a bad habit, it's a neurological loop. When you speed through masturbation, tense, scrolling intense images, using the same grip, same motion, you teach your brain to tie arousal to that exact routine. Over time, your sensitivity drops. You need more pressure, more stimulation to feel what you used to. It gets harder to respond to a real partner. It feels too different, too slow, too real. Stanford University neuroscience studies show repetitive patterns can lead to porn-induced erectile dysfunction, PIED, or even delayed ejaculation, where climax becomes tough or impossible. This isn't just physical, it's emotional. I've seen men spiral into frustration, shame, even depression, thinking their body's broken. But it's not broken, it's overtrained in the wrong way. You might avoid intimacy, feel isolated, or stop looking in the mirror like you're fading away. But your brain can relearn. Slow down, focus on sensation, not the finish line. Cut back on intense visuals and let your imagination lead. Michael tried this, easing up on porn and tuning into his body. Months later, he said, "Doc, I'm feeling again like my body's waking up." This isn't about youth, it's about reconnecting with yourself. If this hits home, type 1 in the comments to let me know you're with me. Now let's move to the next secret, because stopping masturbation altogether might be hurting your prostate in ways you don't expect. The second secret is something most men don't hear until it's causing problems. Masturbation can reduce prostate congestion and inflammation. I'll never forget Robert, a 68-year-old retired mechanic who came to me exhausted. "Doc," he said, "I'm up 5 or 6 times a night to pee, and I feel this heavy pressure in my pelvis." I thought it's just old age. He looked worn out, worried. When I asked when he last ejaculated, he paused. "Years ago, since my wife passed. I figured guys my age should stop that." That's the myth I hear too often, that after 60, you're supposed to shut that part of your body down. But here's the truth. Your prostate never stops working. It keeps producing seminal fluid. And if that fluid isn't released, it builds up, creating a stagnant pool inside you. That leads to prostate congestion, inflammation, and discomfort. Think urinary urgency, weak flow dribbling, or pain during urination or ejaculation. Many guys like Robert chalk it up to aging, but it's a system under pressure. Chronic inflammation can mean medication, surgery, or worse. A Stanford University study tracked thousands of men and found those who ejaculated at least 21 times a month had a significantly lower risk of prostate cancer than those who didn't. That's not a myth, that's data. Robert stopped masturbating because he thought it was appropriate for his age, but it left him with sleepless nights and unexplained pressure. You can change this. Regular masturbation just 1 to 2 times a week, done mindfully, can flush out prostate fluid and reduce inflammation. It's not about lust, it's about care. Robert started again, and weeks later he said, "Doc, I'm sleeping better, and that heavy feeling's almost gone." This isn't about pleasure, it's about keeping your prostate healthy. You wouldn't ignore your heart or blood pressure, don't ignore this. If this resonates, type 1 in the comments to let me know you're still here. Now let's talk about the next secret, because shame might be hurting you more than you think. The third secret is a silent killer of mental health shame about masturbation. I remember George, a 71-year-old widower, coming to my clinic quiet and withdrawn. He finally admitted, "Doc, I stopped masturbating years ago because I thought it was wrong, but I feel empty, like I've lost a part of myself." His voice carried a deep fatigue, not from illness, but from grief. I see this too often, eyes avoiding mine, shoulders slumped when masturbation comes up. George didn't stop because he wanted to. He stopped because he was taught it wasn't right. For many of you raised in traditional or religious homes, masturbation was labeled dirty, sinful, weak. Those messages don't vanish. They sink into your mind, shaping how you see your body, even at 60 or 70. You pull back not just from masturbation, but from connecting with yourself. You start seeing desire as wrong, like you shouldn't want joy. But masturbation isn't just physical, it's medicine for your soul. It releases oxytocin, the trust and connection hormone, balances cortisol, your stress hormone, and boosts mood, sleep, even cognition. Shame disrupts that. It tightens your body, spikes cortisol, and traps you in guilt loops you might not notice. Chronic stress like this is linked to anxiety, depression, heart disease, weakened immunity, even early dementia signs. George carried this shame for years, growing more isolated, losing his spark. It didn't just make him lonely, it raised his risk of depression and heart issues. But you can change this. You don't need pills or big changes, just a new perspective. See masturbation as self-care, like caring for your heart or sleep. If shame feels heavy, talk to a therapist who gets sexual health in older adults. George did this, and months later he said, "Doc, I feel free, like I'm allowed to live again." You're not too old for joy. You don't need to carry shame that's not yours. If this speaks to you, type 1 in the comments to let me know you're with me. Now let's dive into the next secret, because your hormones might be taking a hit from something you didn't expect. The fourth secret is something I wish every man over 60 heard without embarrassment: sexual activity. Even solo boosts testosterone. I'll never forget David, a 72-year-old retired carpenter who came to me drained. "Doc," he said, "I don't feel like myself anymore. I'm tired, no spark, like something's gone." I saw exhaustion in his eyes, not just physical, but emotional. His tests showed testosterone levels so low they were alarming. When I asked about sexual activity, he shook his head. "I don't see the point anymore, not since I retired and live alone." That's the dangerous myth, that as you age, you should let that part of you go. But when you stop sexual activity, including masturbation, you're speeding up your body's decline. Testosterone isn't just about libido, it's your energy, strength, confidence, drive. After 60, your body naturally makes less, but when you shut down sexual engagement, you tell your body you don't need it anymore. Your brain, especially the hypothalamus, gets that message and dials down testosterone production. It's not just age, it's neglect. Low testosterone means more than fatigue, weaker muscles, more belly fat, worse sleep, and a fading spark. Stanford University studies show sexual stimulation, even solo, can trigger short-term testosterone boosts, improving mood, energy, and motivation. David gave up masturbation thinking it wasn't needed, but it cost him his energy and confidence. Low testosterone raises risks for heart disease, diabetes, depression, even a shorter lifespan. But you can turn this around. No drugs or complex therapies needed, just mindful masturbation. 1-2 times a week, paired with 20-minute daily walks and a balanced diet. David started again, and months later he said, "Doc, I feel alive again. I'm back in my garden, laughing more." This isn't about being 20, it's about telling your body you're still here. If this hits home, type 1 in the comments to let me know you're still here. Now let's explore the next secret because your erections are a use it or lose it system you can't ignore. The fifth secret is a truth most doctors don't say clearly enough: erections are a use it or lose it system. I remember James, a 70-year-old retired truck driver who came to me subdued. Doc, he said, I haven't had an erection in 5 years, not since my wife passed. I figured that part of life was over. He spoke with resignation like it was just what aging meant. But when I dug deeper, he wasn't just giving up erections. He thought he didn't need them anymore. That's a lie too many men believe. If you're not having sex, erections don't matter. But erections aren't just about sex, they're about blood flow, nerve health, and longevity. Your penis is part of your circulatory and nervous systems like any muscle or vessel. If you don't use it, the smooth muscle loses elasticity, blood vessels stiffen, oxygen flow drops, and fibrosis, hardening of soft tissue, sets in. Over time, even if you want to use it again, it may not respond. This isn't age, it's disuse. When you stop maintaining erections through masturbation or natural arousal, your body assumes the system's obsolete and starts shutting it down. James gave up because he thought it was natural after losing his wife, but it cost him confidence, left him isolated, even showed early signs of mild depression. Poor circulation affects your brain too, raising risks for cognitive decline. But you can change this. No partner or pressure needed, just regular masturbation 1 to 2 times a week keeps blood flowing, tissues healthy, nerves active. It's not about chasing pleasure, it's about telling your body this system still matters. James started again gently, and months later he said, Doc, I feel like part of me is back. This isn't about sex, it's about health and identity. If this resonates, type 1 in the comments to let me know you're with me. Now let's talk about the next secret, because porn might be rewiring your brain in ways you don't see. The sixth secret is often hidden, especially for older men. Pornography can change your brain. I know just saying that word might make you shift uncomfortably, but if you're still here, hear me with an open mind. This could change how you see your body and intimacy. I remember Henry, a 66-year-old retired salesman who came to me frustrated. Doc, he said, I only feel aroused watching porn. With my wife, I feel nothing anymore. I'm drifting away like I'm losing something. I saw shame and defeat in his eyes. Many men in their 60s and 70s turn to porn, not out of obsession, but because it's the only way they feel alive. Henry didn't realize porn was stealing his sensitivity. Today's porn isn't like the magazines of your 20s. It's a flood of fast, intense, instant gratification designed to hook you. Each time you watch, your brain releases dopamine, the pleasure and reward chemical. But constant exposure to intense content desensitizes your brain to natural stimuli like a partner's touch, voice, or emotions. Stanford University neuroscience studies show heavy porn use can cause porn-induced erectile dysfunction, PIED, where you can only get aroused or climax with digital content, not real intimacy. This isn't just about the bedroom. It brings shame, anxiety, and disconnection from your partner or yourself. Henry used porn to feel alive during lonely days, but it left him numb to his wife. Your brain can change back. It's not broken. Cut back on porn. Let your imagination lead. Focus on real sensations. Spend time on small touches, a hug, a talk with your partner. Henry eased off digital content and tuned into real moments. He said, Doc, I'm feeling my wife again, like I found myself. This isn't about morality. It's about reclaiming real pleasure. If this speaks to you, type 1 in the comments to let me know you're still here. Now let's hit the final secret, because isolation might be the biggest mistake you're making. The seventh secret is the most dangerous mistake of all: isolation. I'm not just talking about living alone. I mean a deeper silence where you stop touching being touched or connecting with your own body. I remember William, a 75-year-old retired engineer, who came to me with an empty voice. Doc, he said, I haven't been touched in over a year. No hugs, no handshakes, nothing. I feel like I'm fading away. He said it with resignation, like it was just part of aging. But William didn't know, touch isn't a luxury, it's a biological need at 60, 70, 80, or beyond. When you go too long without contact, whether with others or through masturbation, your nervous system slows down. Oxytocin, the connection hormone, drops. Stress hormones like cortisol rise. Your blood pressure spikes, sleep worsens, immunity weakens, and worst of all, your brain starts shutting down emotional and sensory circuits to protect itself. You don't just go numb physically, you lose your sense of aliveness, your urge to engage with the world. It starts quietly skipping routines, avoiding mirrors, then stopping dreams of joy altogether. This often begins when you pull back from your body, especially through acts like masturbation. William stopped touching himself, thinking it was right for his age, but it left him hollow, tied to depression, heart risks, even early cognitive decline. Touch is medicine. Masturbation or a friend's hug can bring you back. Start gently with mindful masturbation 1 to 2 times a week and add small connections. Call a friend, join a walking group. William joined a local group and he said, "Doc, I feel like I'm alive again." This isn't about pleasure. It's about telling your body and soul you still matter. If this resonates, type 1 in the comments to let me know you're with me. Now let's wrap this up with a simple way to reclaim your vitality. If you've stayed with me, I want to talk to you not just as a doctor, but as someone who respects your journey. After 30 years working with folks over 60, what hits me hardest isn't medical issues. It's the quiet losses, the ones tests and scans miss. A man who once lit up rooms avoids mirrors. A woman who loved life feels distant from herself. They're told it's just aging. I don't buy that, and if you're here, you don't either. Masturbation after 60 isn't good or bad, it's a tool. How you use it decides whether it strengthens or weakens you. We've covered 7 secrets, how mindless masturbation numbs you and fuels erectile dysfunction, how stopping clogs your prostate, raising inflammation and cancer risks, how shame spikes stress and depression, how masturbation boosts testosterone, energy, and mood, how erections are a use it or lose it system, how porn disconnects you from reality, and how isolation, cutting off touch, steals your sense of purpose. These aren't to scare you, they're to wake you up, to give you freedom to care for yourself better. This stage isn't about giving up, it's about doing things with intention. Your body still responds. Your desire still matters. I want to share my golden protocol: 10 minutes a day, quiet, mindful. Breathe deeply, focus on your body, no pressure. A 68-year-old patient told me I didn't think I could feel this alive just by listening to my body. This isn't about youth, it's about living fully now with dignity and joy. You don't need shame. You're not too old for vitality. Start small with compassion. You're not alone, and you're not done. Hit like, share with someone who needs this, and comment below. Type 1 if this speaks to you, or 0 to share your thoughts. Thanks for being here. Let's keep finding ways to keep you strong and alive.